because everything is a connection. And
Yes.
in this world right now, we are losing that human connection.
Right.
And that is the most dangerous things, because we are stay alone, and everything's come with the mental health and all kind of issues with the substance use. Everything's is
Yes.
come because we are isolated and we are alone.
We have this opportunity to invite people in to our school to get to know us and get to understand public health and what it means and how it can impact their lives and improve their lives, but to do it intentionally over a conversation. This is Brewing Better Health, a series from the School of Public Health at the University of Nevada, Reno, where every cup sparks connection and a healthy conversation. Join Dean Muge Akpinar-Elci each month for a cup of Turkish coffee as we pour insights into public health. Today, Dean Muge is joined by Seema Donahoe, Assistant Dean of External Relations and Engagement at the School of Public Health, to share the inspiration behind Brewing Better Health.
I'm excited that this is our first episode, Brewing Better Health.
Me too. I'm so thrilled that you are doing this. I think it's a great way to build connection.
Thank you so much for being my first guest, because this is your idea. You put me in this stage, so you will be the first guest.
I had it coming.
This is Turkish coffee, and this is very traditional version of the serving the Turkish coffee.
So beautiful.
This is very historical things. Is like around the Ottoman time, and coffee is very important piece of our culture. Coffee is not just coffee. Coffee is a ritual, and also relationship and connection. So this cups is again very traditional cups to keep the coffee warm all the time. And this one is the Turkish Delight, because we drink the coffee with Turkish Delight and the water.
Oh,
That
wow.
is the part. Again, it is a ritual. It's not just one coffee. So in morely, many other cultures is, grab and go kind of things for
Right.
their
That's the
coffees.
society we live in, right?
Yes, but Turkish coffee is not.
Yeah.
Turkish coffee needs, again, companionship, certainly, and is very slow and intentional moment. So why we really doing it this, actually? I want to ask you, because it was your idea, and how you come with this idea.
Well, I think one of there's lots of things I love about our School of Public Health, but I think in working with you and for you, I think this leadership and vision that you bring, but is also this piece of culture that you bring to it, and how you've shared Turkish coffee with others and this ritual. And there is this connection. There's something very special that happens over this. And I've been fortunate to get to enjoy Turkish coffee with you. But it's very much an invitation. And I think that that's part of what I feel public health needs. And we have this opportunity to invite people in to our school to get to know us and get to understand public health and what it means and how it can impact their lives and improve their lives. But to do it intentionally over a conversation, not just, this is what we're doing, but really bringing some humanity to everything.
But I guess the key is humanity part, because with the coffee, just in our culture, there are many big decisions made it over of the Turkish coffee, because that is very cultural things. Again, when the people come, if you are discussing or debating or just, you cannot argue too much over the Turkish coffee because you are enjoying the moment.
Right.
But everything is in this moment is, again, slow down and listen and deeply listen, but also don't care about the time that much, because sometimes you really miss the time, when you are doing that conversation, and just be on the moment. I really want our, hopefully, followers later on, they really leave the moment and just take a deep breath and just slow. That's
Right.
it. Because world is very crazy right now.
Yeah. And join us for a moment.
Exactly. Currently in the world right now, we are rushing everything's.
Right.
And everything's is a little bit fragmented and just, we are not in the moment.
No.
And we are missing the
Yes.
time. But hopefully that Turkish coffee will remind us to stay in the moment
Right.
and just listen.
There's it applies to so many things with our health too, I mean, I even think of the culture of coffee. So many people drink coffee and it's to fuel themselves so that they can be more productive, and do more. And so this is very...
This is like a circle, but...
Yeah, but this is asking a different question. This is asking you to slow down. And I think we all also know, and I think there is this awareness of people wanting to preserve health and promote a healthier lifestyle, better mental health. And these are all facets also of public health that a cup of Turkish coffee
can do it. Just exactly. Yeah. And in this video series, we are not really trying to lecture to anybody or, just a sound bite or anything. We are really focusing here who we are as a people.
Yes.
I really want to make the public health more humane, just to feel more humane side of the public health. Because all of us, we have very ambitious about what we do in the public health. It's all kind of very passionate and just driven people in public health.
Right.
And I really want to give that perspective, who we are as a human, not just, again, lecturing to don't do this, or do this. It's not. This is conversation.
Yes, absolutely. I love you. You've spoken a little bit about Turkish coffee, and I think there's a proverb related to it, correct? Tell me again.
Turkish coffee is not just a coffee, and for us is the coffee. If you give me 1 cup of coffee is remembered for 40 years.
Yes.
And the meaning is just mutual respect with the, just somebody care about you and give you coffee. And this is exactly like a public health things too.
Right.
Public health is sometimes so slow in many sense, and we don't remember what we did it before. Just the historical content. Public health has a lot of success.
Right.
But everything is more slow, settled down, and we are missing that remembering part sometimes.
Because when it's working, it's happening in the background.
Exactly.
And you don't know.
And as a public health people, we don't like too much be hero kind of things, because you don't come to place and save everybody, just did that. I guess our perspective is more how we can stop everything before anything happens. So, but in that case, people forget us much easier and quicker.
And I think that's another thing where we have such incredible people doing very important work, and they're not going to be the one tooting their own horns. Or, there's very much a genuine curiosity about how can we improve health, how can we promote and prevent, promote good health, but and safety, and prevent, the harms that can come our way. And everyone is just, there's truly a culture, again, within the School of Public Health of rising together. So how do we support each other and support our communities to rise together?
Because everything is a connection. And in this world, right now, we are losing that human connection.
Right.
And that is the most dangerous things, because we are stay alone. And everything's come with the mental health and all kind of issues with the substance use. Everything's come because we are isolated and we are alone.
Right.
Why I'm saying that, in Turkish culture, I don't grab the go this coffee. I need a person to sit with me and enjoy. And please enjoy.
I know.
I want to make sure that you enjoy.
Oh, it's so good.
As a Turkish proverb, we say that one cup of coffee is remembered for 40 years. Related with this proverb, what do you think, what is your moment in your life that is standing that lasting impact in your
Yeah,
life?
a conversation or a moment that
Moments.
stays. I think I was just having this conversation earlier today about how, the gift of memory and how, different tastes or smells and, just different things can bring a memory back and take you right back. But there's a conversation that I actually had with my grandfather when I was maybe 14, 15, maybe. I was in high school and I was doing journalism and, the high school paper and writing stories. And that being a reporter wasn't something that necessarily like my family understood. Most, they understood if you wanted to become a doctor,
or engineer,
right? But here I was wanting to talk to people and tell their stories, and so, but my grandfather was, he was a voracious reader. He loved to, he read so much all the time, even into old age. And I was like 14, 15, and he was so proud of me and the stories I was telling. And he talked about how in that line of work, you are always learning and you're always staying curious and asking questions. And I don't think I realized it then, but it's funny how often that exchange, like I can see myself in the room, having this conversation. I remember, all of this. And it still stays with me because here I am now, and it's still something that I'm doing now today. My career has taken different paths, and it's always come down to staying curious, continuing to learn, and wanting to share those stories in a way that can help people,
Because, you are a very creative person also in a sense, and it's really bringing that curiosity, trying to learn more and understanding, but also how you are, translating that learning to the impact, that this is the key component actually of the life. That is really beautiful.
Yeah, and it comes back to science and the work of public health because we are being curious about how we can help.
Exactly.
And so to be a part of that, it feels, like it all fits in this trajectory. That I've been on.
You're going that way. It is, again, public health is sometimes, or just a science, it's suffering because of that part too, because you are curious, you want to learn more, you learn something and you just translating what you learn to the real life, but you are continued your curiosity. You learn something else.
You learn something new.
Maybe that didn't work, or it was not perfect yet.
Right.
I'll want to bring to something else. But this kind of thing sometimes causing the trust issue.
Right.
What I'm seeing, in public health, it happen always. Just because again we are going to for fact try to understand the science and implement and just change to something in the real life, but then looks like you are changing your message constantly, and that causes sometimes again that not trust or mistrust to science or the public health.
Yeah, I think that's all the more reason we need to have these conversations so that we can continue to inform and learn. Because circumstances change, that if we're not continuing to look at the data so we can, how can we confirm and know, so we continue to let science lead, where we're going.
Better results and better life, just everything, brewing the better health.
Right, exactly.
This is what we are trying to do. And again, thank you very much, really, just joining me today.
Yes.
And hopefully people, they follow us with this series. So I want to really, when the people listening us, I really want them to pause and just really just listen deeply,
Yeah, I think you can get inspired by the conversations we're going to be having. I think that there really is a tipping point that is happening where people truly are curious about their health and wanting to do the right things, and they're looking for answers. And I think that this can hopefully be a good place where people can come and learn about the people behind this work.
Exactly, because just always one main thing is, if you have a relationship with that entity, if you know them, you trust them. Mm-hmm. Trust comes with the relationship,
right.
And just because you can see that people care about you, you can understand what they are trying to do, and you start the trusting to people. I'm really hoping that this series really helped the people to understand more public health and just create some relationship with more human-based, personal relationship with public health. So hopefully it will bring the trust.
Yeah, develop trust through it. And I think that I thank you for being open to this and how you do share these moments. And I think it's going to...
Over the Turkish cup?
Yes, pouring insights one cup at a time.
Exactly. But thank you very much again for joining me today.
Thank you. Take a peek at what's ahead on Brewing Better Health.
Well, here's what we know, Muge. Here's what we know is that, especially with physical activity and health, it is not a requirement in the elementary schools here in Nevada. But what we know and what research does show us is that our healthy habits start early. When you see kids excited to learn about physical activity, to learn about health, it gets you excited because you know that, wow, I am making a difference.
The illegal drug market is so unpredictable right now, right? It's so volatile and it's so dangerous. Every time somebody that I know dies of a drug overdose, I question everything.